Let's talk about lips, baby. Let's talk about you and me. Just kidding. Today's episode, we're going to talk about lips and everything related to lips, lip filler, lips and Botox, and basically the things that I can do as a PA in plastic surgery with the lips that you present to me. That is a key. I really do think that this is something that is definitely more than one episode, but we're going to try to get it started and kind of hit on the high points with it. When I say the lips that you bring me, it's because no matter what our goals are, those goals can sometimes be determined by what you bring me. You know, if you bring me a very thin lip, if you bring me a big lip, if you bring me youthful lips, older lip, lips that have been aged by the sunshine, lips with a top lip that is bigger than the bottom lip, or all these different things. I can manipulate a lot of things, but there are still limits based on what you bring me, and that is the clear and honest truth. Oftentimes I see on social media folks posting before and afters where the afters look excellent, but if you pay attention, all of the befores also look pretty damn good. Maybe they're all youthful, hydrated. What I want to see is, what did they do with the aging woman's lip? What did they do with the person that spent most of her life in Miami? That's how I know how good somebody is at lip injections. Lip injections and the desire to make the lip fuller really, to me, is based on the person that's injecting. You come in and you tell them, what can you do with my lips? This is what my goals are. Can you do that? Similar to what folks do kind of to the hair person. If I don't think that I can produce what you want, I'm going to tell you. So when it comes to lips, again, it depends on what you're presenting, what you're bringing me. And then I like to kind of know what you're thinking. So when we talk about lips, we've got different goals, and I will often ask what those goals are. Some people don't really know. You know, if you want the lip to be more full in the center area, more of a heart shape, we'll say all kinds of different terms that you'll see on the internet. Do you want the lip to look a little wider? Do you feel like you have no lip? Because sometimes that's the truth. A lot of times, my goal is to try to guide the person that's in front of me, to tell you what I think is going to be best for the lip that you're presenting. In addition to that, it also depends on corners of the mouth. There are a lot of variety of features. The type of filler that we put in there also can make a difference. So again, lips can take up a series of episodes, and I hope to help you kind of be more educated on what you need. What I can tell you is that unless God gave you an upper lip bigger than the bottom lip, in general, your bottom lip needs to be percentage larger than the upper lip, or it just looks strange in my opinion. The other thing to know, that myself as a PA or another injector out there has the ability to say no to you. If it doesn't seem like it's a safe option, or if it seems like it's going to make me look really bad, I often will just tell somebody they need to go to a different injector. And I like to disclose that very honestly, because it's my reputation as well as to what I'm putting out there. Now again, I'm open to discussion with patients, but there are a lot of things that limit what the results will be. An experienced injector is truly what you need. It's not based on what somebody's social media before and afters really are. I hear folks say that, and I kind of shake my head inside, although I smile on the outside. But what you got to know is I do not take good before and afters simply because I'm extremely busy, and I don't have anybody to do that for me. That is second on my list. My very first thing is to make people happy with the appearance. And I got to be safe. I got a lot of things to think about. I have a lot of things to study. Even at 15 years in, I'm studying all the time on a regular basis. What can I do to make these lips look the best? I'm also trying to budget for you. You know, I tell my patients all the time, I say, all right, let's talk like you're Oprah, but I have yet to meet her. Now, I've got folks with endless amounts of money, and I got a lot of folks that don't have endless amounts of money, and I want us to get the equal results and definitely want to be the safest about it. So when I'm talking to you about these results, I'm first going to tell you as if you're Oprah, and then we're going to talk realistically. I will be honest, if you're under the age of 25, I probably have a better idea that you're going to want full lips. Not always true, though. Sometimes it's very conservative. But a lot of times I get an idea of what our goals are. We have a little bit of a different conversation. I'm going to talk about that in a different episode, really. But in general, when you tell me what the goals are, I'm also going to maybe choose different products. I thankfully work at Northeast Georgia Plastic Surgery, and I've got about every product that's out there and approved available to me. Thank you, guys. I work specifically for Dr. Walton. Thank you, Dr. Walton. But thank you to all of them for having so much that is accessible to me, because then I can truly pick what's best for the patient. So again, I'm going to ask what the goals are. That's what should happen. Then I'm going to see, what do I think is going to best meet your goals? What filler out there? Probably the largest companies that currently are available right now are Allergan and Galderma. Yes, Mertz, you're out there for Bellatero and things. That I'm going to go through kind of what my thinking is. But even in me talking to you, this is just highlights. A lot of it is I got to see it myself. So I'm going to specifically talk about these companies, although there's some outliers that are out there. But those are the two that I'm going to focus on right now because I feel like those are primarily used. Different offices may have one or the other. And thankfully, in the last probably 2 or 3 to 5 years, we've got options in both of those companies that will meet most patients' needs. So whether or not you go to an office that has Galderma or they have primarily Allergan, or a lucky place like me where I get those and others, then that's all right. So, what you're looking for is the experienced injector. Now, let's talk about Allergan, which is primarily when we're talking about Juvederm type products. Just to confuse us a little bit, every product that they have has the word Juvederm before it. But in general, when you say Juvederm, you're thinking Juvederm Ultra versus Juvederm Ultra Plus. Now, XC added to those is really like the lidocaine, so don't think too much about it. But Juvederm Ultra, a little softer, okay? Juvederm Ultra Plus, a little bit more power, a little oomph. What's the difference on what I'm going to use in the lips? That kind of depends on the personality of the patient. When I've got somebody that's been used to using Juvederm Ultra Plus, I'm not usually going to go backwards to Juvederm Ultra. But if we're looking for a little bit of a softer point, maybe it's the Ultra. Ultra Plus is probably going to stay a little bit longer. Sometimes I'm going to use a combination. Try not to control your injector too much. Let them do what they're good at. Sorry, just my point. Now, let's talk about Velour. All right, Velour is going to last a little bit longer. That's still out of the Juvederm line, so let's call it Juvederm Velour. It's going to last a little bit longer. Softer product. FDA has approval for like 1.5 years. I'll explain that, in my opinion, a little bit on all of that with all the products in a minute. But Velour is a Vycross product, so we might have it lasting a little bit longer, still being softer, but the technology is a little different. Now we're going to go on to Volbella. Still a Vycross product in the way that it's going to hold, but we can use it more superficially because it's not going to show as much of a blue hue under the skin. So we can use it more superficially. It goes a little bit longer, but really that product is probably better for the person that doesn't really want much, just wants to help those little tiny fine lines, not going to be adding volume. That product goes a long way. Usually there's only about half a cc in most of the syringes. I primarily do not use that in the lips as much, but again, I'm usually trying to get a big bang for the buck. I'm not wrong or right for that. Again, it just has to do with your experienced injector. I'm using that primarily for the perioral lines around it, but still, it's an option that's out there. Typically, that is cheaper because it's not going to last as long. You really need to leave that to your experienced injector. It is not on label to do like most of the things we do, but Voluma is another option. If you really want to make some stout lips that last a while, well, that's Voluma, but I personally don't think that's a good idea to put there. It has some risks involved, and again, that's a lot more than I can talk about right now. So those are not bad products to use. Just know that the Ultras in general, the Juvederms, they're hydrophilic. They're going to pull water in. So it might make a little bit more of a plump look. Very nice for the person that's really wanting nice pout and projection, and good for the person that doesn't. Again, it just depends on the experienced injector. When we get to the Galderma line, you're really looking more at your Restylane products, which over the last several years, like Allergan, has given us a lot more products to choose from. When you get into Restylane L, which the L just stands for lidocaine, the same as the old school Restylane, which was around way before Juvederm. When we're getting into that product line, we've got some variations to it. To me, Restylane is a little less soft than Juvederm, but it's also a little less hydrophilic in my opinion. Key here, everything that I'm saying here is my opinion. But when you get into some of their variations, Refine. I've got somebody that comes in, they really don't want to have overdone lips. They want just a little, kind of their testing. Then Refine is kind of like Gumby. it stretches, it's going to go a long way. It's going to look very natural. But quite frankly, it's not going to last a long time. And I got to think through your psychology. And by the way, we're not trained as psychologists, but we got to think like that. So this is something that I use for the person. Sometimes it's just starting and really kind of scared of getting their lips done, but I really feel like they're in need of that to help kind of find lines around the area. And I'm not going to go into other uses for that, but that's something a little less robust, but a good way to kind of dabble into lips and has nice stretchability and a nice appearance. Next, you've got Define for the lips. Some folks that I really respect use a lot of Define. It's more robust than the Refine. I think it's kind of in the Vicross quality, or I think it's kind of in the Vicross family, but anyway, that's a different discussion. So again, a little bit more robust for things, but it has some positives and negatives, and that's based on your injector. And then we can also get into Silk that is in that same line. Now, I really like Silk, but you got to have respect for Silk because Silk loves to swell on us. But it has a place, and I'll just kind of leave it there. Now, there's some outlying companies like Mertz, and you get into Bellatero, which doesn't last quite as long, but again, for the person that's kind of scared of it, that's a good place to start, although I think it burns a little bit more. But anyway, the key to all this is that you need to go to an expert injector with a good reputation and ask them to do what's best to meet your goals. When you're the patient that comes in and tries to really micromanage your injector, it's not good, okay? And if your injector lets you micromanage them, you need to walk out. That's all I can say. I'm going to do what's best, and most great injectors are going to treat aesthetic medicine just like it's any other kind of medicine. We're going to talk about the goals, and whether that's in primary medicine to get you better, or the goals are, I'm going to tell you what I think is going to help you meet your needs. That's really what you need to do is let them run with it, because that's really what's in your best interest overall. Again, I could go on about lips forever and ever. I used to tell folks that they could do whatever they wanted the night of the procedures, but as far as instruction goes, I've now changed that and said, please be gentle with the lips afterwards. Now, the only folks who have stretched what I've wanted on that is pretty much, again, my under 25s. Thank you, girls. Thank you, boys, for coming under 25. But you make me think about what my instructions are. I tell folks that usually for the first week, you can expect kind of some drying lips. That's normal. You got inflammation to a small area. Just know that's normal. It's normal to look weird when I'm done. It's normal to look weird no matter who takes care. We just stuck a needle in your lip. So you're going to have a little bit of some bruising, some inflammation. Just chill out. Don't touch them. You're going to have some bumps, some lumps, some bruising. That's just normal. If you don't, good. But be gentle with them. Respect the fact that there's a mild injury going on. No lip masks. No special stuff. Please don't touch your lips very much for a week. Brush your teeth like normal. This is not the time to get a dental visit. If you got to get a dental visit, go ahead and do it. But these are all the things to think about. It is preferable that you do not take ibuprofen, aspirin, or anything that's going to make you bleed for about a week going into it or a week afterwards. Now, every injector has a different rule on this. I do not tell my patients who are on Coumadin or variables of that to stop those products. I personally do not think it is worth you having a stroke to stop those products in order that you get your lips filled. But that's just a personal, opinion. I'm just telling you that. Exercise. Officially, stop exercise for 48 to 72 hours. But in general, just don't do, high intensive exercise for about 24 or so hours. And then you got to ask your injector, what are they comfortable with? Again, an experienced injector has opinions based on what they've seen over the years in the past, and that's just that. In a different episode, I'm going to talk a little bit about fillers, how long I really think they last. But what I would tell you is if you just Google it, and what you Google matches what your injector tells you, they're just saying what the FDA approves. But in general, we can tell you kind of what we actually think. Again, I'm gonna say that for a different episode overall. Lip flip. Oh my gosh, you guys love the lip flip sometimes. Sometimes you don't. Lip flip has to do with techniques around how we inject the filler, and sometimes putting a neurotoxin such as Botox, Dysport, Xeomin, or Nutox or Juvo around the lip to affect the muscles. But that has positives and negatives. Again, I'm going to talk about that a little bit further, but if you're wanting the lip flip, you just got to talk to them about it. And like I said, there's positives and negatives to that. And certain fillers are known to be good. Most recently, Restylane came out with a product called Kiss that has been available in other countries prior to now. I really love the product. It was launched basically trying to instruct us a lot on the lip flip. Quite honestly, the instruction on it is very similar to some instruction that Volbella had out, which is through Juvederm. And I quite honestly think that you can use a variety of products to help to flip the lip through injection. It's just a matter of technique and making sure that we're utilizing the correct filler. If somebody comes to me and they have no lip and they're wanting a lip flip, I can tell them, look, we got to build you some volume first. Again, it goes back to go to the experienced injector. They're going to tell you what's a good idea or not. If you're coming in and you need some volume first, and then I'm going to lip flip you maybe in a month or so, I'm going to tell my patients what I think is best. The flipping of the lip when I'm using a toxin, those that I discussed before, if somebody comes in and they're thinking conservatively, I might go ahead and fill them on the first go and then tell them, hey, if you're wanting a little bit more, why don't you come back in like 4 weeks? Let's try one of the Botox, Dysport, Xeomin, or Juvo type products to add a little flip there so that you can see. But a lot of times I want to separate it on the first go so that you know what you like or not. My goal is to educate you. I've got no secrets, but my goal is to educate my patients so that they can decide what they like and that they desire, because that also changes as we age. Unfortunately, the volume changes. Now, I'm going to share my opinion. I'm also not going to do what I think is a bad idea. I do overfill lips sometimes. Again, my under 25-year-olds or some of my over 60-year-olds. But I usually follow that very much with, look, I'm only going to do what is safe. And I need you to also tell folks this is not what I desire the most. But I also tell folks I got a tramp stamp from when I was 18 that's huge and ugly. At least I wish I would have chosen something different. And to me, lips in large volumes, especially my younger folks, it's kind of in that trendy category, but I can reverse it. It's safe and it goes away. The other thing I want to touch lightly on is that when lips look funny, to me, in general, unless it's the patient really desiring something different, it's the injector's fault overall. Like I said, I've got lips that are out there that are much larger than what I want, and each of those patients know it. I am so open. I describe everything, which is why, unfortunately, a lot of my patients wait forever. Thank you guys for being patient with me. But I'm going to tell you what I really think, just like we are the best of friends sitting at dinner. And when someone comes in to me and asks that their lips be filled, or to touch lightly on any other area be filled, I'm going to look at the whole face, whether or not they asked or not. Because although in public I don't see faces, I'm thinking about myself when I'm in public. I'm trying to get things done, whatever, and folks can say, yeah, it's because it's work and you don't want to think about that. I can't even say that. I'm Katie Allen, and my brain just doesn't think that. Now I'll see a suspicious lesion, a trach scar, you walk like a funny gait that I think might need to be corrected. Now, my brain will see that, but I don't see the aesthetic things, because I genuinely think that I am blessed by God to see people as who they are. But when you come into the office, I am there to critique your entire face, to tell you what I think is best for you, even if you came in and asked just about your lips. The reason why I bring this up, my young folks, we can get away with just injecting your lips. My 30-something-year-olds, sometimes we can get away with injecting the lips. I will always look at those oral commissures to see if they need to come up. But when we're getting towards the end of the 30s and reaching all the other decades of life, a lot of times the reason why the lip injections look funny is not that the lip injector did a bad job, but we forsake looking at the entire face. So that's an episode in itself where I'm going to say why lips to me in an aging person when injected often look funny. I'm going to save that for another little episode, but there's reasons why that is and how you can correct it. My goal with folks is genuinely to make you happy. There's a lot more to be stated about lips. Lips are complicated. I love doing them. They hurt like hell. I'm glad for all those that tell folks that they're able to do something that makes them not hurt like crazy. I find that anything that blocks them too much, it gets in the way of me injecting. That's just my personal opinion. I try my best to make it as comfortable as possible. It is not a long procedure, and most everybody gets through it just darn fine. As far as how long do you need to be away from folks, if you don't want anybody to know about your lips being injected, minus bruising, which I really don't have much control over, you're hiding from folks for a couple of days. Right now, we're in a mask world. That may not be true when you're listening to this later, but right now in a mask world, you can hide them pretty easily. But I would tell you that lips in general look a little funny for a couple of days to 3. Your primary swelling is about a week, but then you get out to about 3 weeks. It is quite common that at the end of 3 weeks, folks think that filler has disappear. That is because you just have swelling that continues. You get used to what it it was like, and then you go, oh, I really want to go back to having a little bit more, and oh, my lip filler's just gone. Or folks come into me and they go, well, so-and-so injected me and it just didn't work after so-and-so. I say, about how long were you happy with it? It's funny how many people go to about that 3-4 week period. What I can tell you is that you get used to the swelling. That swelling is there, dissipates to me from what you visually see around the 3-week mark. The filler did not just disappear. You build a little bit of collagen off of that injection. Now, what I tell most folks is expect that you may or may not want to come back for a little bit more lip filler at around the month or 3-month period. Just expect that. The only reason why I say that is I've got no control over the building of the lip. You want to build up a lip, you pretty much need to expect to have at least 2 injections. I personally will not put in more than 1 syringe at a time. I just think there's too much swelling. If there's too much swelling, leaves you open to having, I think, some increased risk of injection increased migration possibilities of filler. But if somebody else feels good going ahead and doing more, that if they're experienced, you just got to go with whatever they feel good with. But I tell folks no more than 1 in the lip specifically at one time. I have one person that I did that on. You know who you are. It looked like botched. The amount of swelling that this person got and how long it took for them to go down was just ridiculous. So again, 1 syringe, you might come back in a month to 3 months. Let's put a little bit more in. It might be a little bit more after that. You're not the crazy lady down the road. That's just the safest way to approach it. And my patients know that. I tell them that. But I like you to know that's a normal thing, is to build that filler over time, or maybe adding a toxin or not. Looking at the whole face is important. Again, as we inject the lips, there's safety things that they need to ask you. I'm going to go back over lips again in future episodes, but this was just a little dabble in to let you know kind of the thinking of an injector when it comes to lips, at least an intro to that. And I hope this helps with some things, give you a little thoughts from a plastic surgery PA, again, with over 15 years of experience. Injection, how things have changed. We now have so many more tools than when I started. We had so few things available to us when I very first started for the lips alone. And really, we did a lot of self-teaching. There's very few people to talk to about this as well. But thankfully, things are changing. We can do so much more with the lips. We can meet every goal I feel like is possible, whether it's more of a natural look, kind of a moderate look. Let's all the lips thin over time. And are we trying to just bring those back, give you more than what you had, or really boost them so that they're nice and luscious? Those are all the things that we talk about. My goals are typically very natural looking results, but I am open to talking to a patient if I feel like our goals are quite clear. And again, really in the end, what our primary goals are to safely make you the most pleased. And I hope that as a injector that I am doing that for my patients. Thank you all for listening today. Have a wonderful week.